Turning to another horrendous humanitarian situation, that is Gaza. The Office for the Coordination of Humanitarian Affairs warns that the humanitarian situation is now likely to be the worst it has been in the 18 months since the outbreak of hostilities. It has now been a month and a half since any supplies were allowed through the crossings into Gaza, by far the longest such halt to date. Our humanitarian colleagues on the ground report a surge in attacks causing mass civilian casualties and the destruction of some remaining infrastructure that's needed to keep people alive. This includes yesterday's Israeli airstrikes on Al-Ahli hospital in Gaza City. Dr. Tedros, the head of WHO, said that the Al-Ahli hospital has gone out of service after receiving an evacuation order and being attacked. He called for an immediate halt to attacks on healthcare and reiterated that patients, health workers, and hospitals must be protected in line with international law. Also yesterday, a UN warehouse in Gaza City and a community food distribution point that we supported in Khan Yunis were hit by strikes. Our colleagues have confirmed damages to the warehouse. Meanwhile, Israeli authorities continue to issue additional displacement orders, further reducing the limited space available for families. Civilians are effectively trapped in an increasingly fragmented and unsafe enclaves in Gaza, where access to essential services for survival is dwindling day by day. 4 new displacement orders were issued over the weekend, 2 on Friday and another 2 on Saturday. Some of them followed reports of Palestinian rocket fire. Combined, these latest orders cover more than 33 square kilometers, which is more than half the size of Manhattan Island, or approximately 9% of the entire Gaza Strip. Hundreds of thousands of people lived in those areas. Based on our assessments from February, these areas also included medical points and other facilities supporting people's survival. Currently, about 70% of the Gaza Strip is under displacement orders or in no-go zones, where Israeli authorities require humanitarian teams to coordinate their movement. And I can tell you that displacement orders are, of course, undermining access to half of all water wells across the Gaza Strip. Our humanitarian colleagues also report that due to the closure of the crossings, compounded by restrictions within Gaza, dwindling supplies have forced them to ration and reduce deliveries to make the most of the remaining stock. Over the weekend, we were able to relocate some existing fuel stocks from areas under displacement orders to locations where they're more easily accessible by humanitarian workers. But just to be clear, we have not been able to bring fuel into Gaza since this latest closures began.